guys, I'm Johanna and I'm in a group with Emma and Margaret, and we chose to research hepatitis A. So hepatitis A is a highly contagious liver infection caused by the hepatitis A virus. The virus is one of several types of hepatitis viruses that can cause inflammation of the liver and affect its ability to function. It's extremely rare, so there's fewer than 1,000 cases per year in the United States. Hepatitis A signs and symptoms typically don't appear until you've had the virus for a few weeks, but not everyone with hepatitis A develops these symptoms. If you do, the signs and symptoms can include fatigue, sudden nausea and vomiting, abdominal pain or discomfort, especially on the upper right side beneath your lower ribs by your liver, clay-colored bowel movements, loss of appetite, low-grade fever, dark urine, joint pain, yellowing of the skin and the whites of your eye, also known as jaundice, and then intense itching. These symptoms may be relatively mild and go away in a few weeks. Sometimes, however, hepatitis A infection results in severe illnesses that last several months. Hepatitis A is caused by very contagious HAV virus. HAV settles in the liver and then it causes the infection. The disease is transmitted through the fecal or oral route, which includes contact with infected saliva or fecal matter, close person-to-person contact with an infected person, sexual contact with an infected person, and the ingestion of contaminated food or water. So these are the assessments and diagnosis. A patient history will be obtained to confirm or better understand how the patient contracted or been exposed to hepatitis A. In the physical exam, a doctor may look for signs and symptoms of hepatitis A. He or she can press gently on the abdomen to assess whether the liver is swollen or tender, or examine the patient's eyes or skin to look for jaundice. A psychosocial exam may be needed to address anxiety, depression, or other psychosocial factors that the patient may be experiencing. Those with hepatitis A may require counseling or support as they experience painful or frustrating symptoms and seek treatment for these symptoms. A blood test called IgM, anti-HAV, is needed to make sure you have hepatitis A. This test looks for any infection-fighting cells, also known as antibodies, that you may have against hepatitis A, the virus, in your blood. And if these antibodies are in your blood, that means you recently have been infected. There's no specific treatment for hepatitis A, but it is important to rest because many people with hepatitis A feel really tired and sick, so rest may be necessary. And you can manage the nausea, so it may be difficult to eat, so snacking throughout the day instead of eating like 3 big meals is important and can help you feel better. And then I also suggest avoiding alcohol use and medications. Your liver may have a hard time processing alcohol medications, so don't drink alcohol, and your doctor will discuss with you which medications you need to take and which ones you should avoid. And this is my prevention slide. So hepatitis A can be spread through the ingestion of fecal matter, even microscopic amounts by touching objects or eating food that someone with the hepatitis A infection has handled, close to person-to-person contact with an infected person, and use of recreational drugs, whether injected or not, and then sexual contact with someone who has a hepatitis A infection. So what can you do? Vaccination is the best way to prevent infection. Also practice diligent hand washing for at least 20 seconds after using the bathroom and before and after you eat. Do not share needles, food, drinks, cigarettes, towels, or personal items with others, especially if you know they have hepatitis A. About 15% of people infected with hepatitis A will have symptoms that last longer or relapse for up to 9 months. But normally your body will clear the virus on its own and the liver will be able to heal within 6 months with no permanent damage. If your symptoms become worse or regress, contact your doctor. To prevent being reinfected, avoid close contact with people confirmed to have hepatitis A. Peel and wash all your fruits and vegetables. Don't eat raw or uncooked meat, and avoid all drinks with unknown purity. You should also consider receiving the vaccine. And here is my source. So if you have any questions, you can go to this source. Otherwise, you can